Malaria is a mosquito-borne infectious disease that affects humans and other animals. It causes symptoms that typically include fever, tiredness, vomiting, and headaches. In severe cases, malaria can cause yellow skin, seizures, coma, or death. Symptoms usually begin 10 to 15 days after being bitten by an infected mosquito. If not properly treated, people may have recurrences of the disease months later. In those who have recently survived an infection, reinfection usually causes milder symptoms. This partial resistance disappears over months to years if the person has no continuing exposure to malaria. Malaria is caused by single-celled microorganisms of the Plasmodium group. The disease is most commonly spread by an infected female, Anopheles mosquito. The mosquito bite introduces the parasites from the mosquito's saliva into a person's blood. The parasites travel in the blood to the liver, where they mature and reproduce. 5 species of the parasite Plasmodium can infect and be spread by humans, with most deaths caused by P. falciparum. Malaria is typically diagnosed by the microscopic examination of blood, using blood films, or with antigen-based rapid diagnostic tests, although PCR tests are not widely used in areas where malaria is common, due to their cost and complexity. The risk of disease can be reduced by preventing mosquito bites through the use of mosquito nets and insect repellents, or with mosquito control measures, such as spraying insecticides and draining standing water. Several medications are available to prevent malaria in travelers to areas where the disease is common. Occasional doses of the combination medication sulfadoxine and pyrimethamine are recommended in infants and pregnancy after the first trimester in areas with high rates of malaria. Despite a need, no effective vaccine exists, although efforts to develop one are ongoing. The recommended treatment for malaria is a combination of antimalarial medications that includes an artemisinin. The second medication may be either mefloquine, lumefantrine, or sulfadoxine pyrimethamine. Quinine, along with doxycycline, may be used if an artemisinin is not available. It is recommended that in areas where the disease is common, malaria is confirmed before treatment is started, due to concerns of increasing drug resistance. The disease is widespread in the tropical and subtropical regions, in a broad band around the equator with 216 million cases in 2016. Resulting in an estimated 445,000 to 731,000 deaths. Approximately 90% of both cases and deaths occurred in Africa. Rates of disease decreased by 37% between the years 2000 and 2015, but increased from 2014, during which there were 198 million cases. Malaria is commonly associated with poverty and has a major negative effect on economic development. For instance, in Africa, it is estimated to result in losses of $12 billion a year, due to increased healthcare costs, lost ability to work, and negative effects on tourism.